Yeah, we appreciate you all making time to join us here today. We always look forward to our Windows on Waterloo presentations. We host these on the first Wednesday of every month. So if this is the first time that you've joined us, we're excited that you're here and hope that you can join us again in the future. We host these sessions just to talk about things that are impacting our community, whether those are challenges or tough issues that our community is working on, or if it's like cool projects or opportunities that are happening here. We really try to cover it all, and just a place to learn more about uh, the things that are impacting us as community members. And so appreciate you guys being here and hope you'll join us again. My name is Paige Price. I'm the program manager at the Waterloo Community Foundation and host these sessions each month with you guys as well. And we are really excited. Today we have Caitlin Emmerich, who's the director of Blackhawk County Public Health, and then Erin Rinke, who's an epidemiologist with public health as well. They are joining us to take a closer look at local cancer trends here in our community. I feel like this topic has been bubbling up within the community as some data has come out both at the statewide level and then here locally as well. And so they're going to be giving us some really good, a look at what trends we're seeing here locally, and then how that impacts broader community health too, when it comes to access to preventative measures and screenings and treatment and all of this. You know, it's not just about one single disease, but how are all of these factors working together? And so we're really grateful that they're joining us to share the information that they have. We also have one of our fund advisors here at the Waterloo Community Foundation. Diane Anderson is joining us. She has a fund called the Accessing Cancer Treatment Fund, where she is raising money to help support some of our local providers in helping those who need assistance accessing their treatments, or kind of closing the gap to make sure that people can get the healthcare that they need when they are dealing with a diagnosis. So we'll have a chance to hear from her about the work that she's doing as well. We hope to have some time at the end for question and answer, so feel free to type those into the chat throughout the presentation and we'll address those all at the end. You can post those publicly so that the whole group can see them, or you can just send them to me privately as well, and I'll make sure that we ask our presenters those. So I think that's all my like housekeeping type stuff at the top here. And so with that, I will pass us over to the experts here, and we'll hear from Caitlin and Erin. Thanks so much for being here, you guys.
Thank you, Paige. I'm just going to take a second to share my slides. Okay, those should be available for everyone now. As Paige mentioned, my name is Caitlin Emmerich. I'm the Public Health Director for Blackhawk County Public Health, and I have with me Erin, one of our epidemiologists. And we're going to take a little bit of time to talk about cancer trends in Blackhawk County. Most of this information was presented at the 99 counties presentation that was hosted by the Iowa Cancer Registry on May 12th here in Waterloo. There we go. So to give everyone a little bit of background on cancer surveillance, cancer is a reportable disease in Iowa, as identified under Iowa Administrative Code. And the Iowa Administrative Code designates the Iowa Cancer Registry as the public health authority to collect cancer data in Iowa. HIPAA does allow for this to happen since it's a reportable disease. And the Iowa Cancer Registry is a population-based cancer registry that has served the state of Iowa since 1973. And they are a member of the National Cancer Institute Surveillance Epidemiology and End Results Program, or SEER program. So a lot of the data that we're going to share today is derived directly from the Iowa Cancer Registry. They do most of the heavy lifting, and they do serve as great partners to be able to share data with local communities like us so we can get that information out to our communities. As I mentioned, a lot of the data in this presentation is obtained either directly or indirectly from the Iowa Cancer Registry. And there was a presentation on May 12th where Dr. Mary Charlton and Dr. Sarah Nash from the Iowa Cancer Registry presented a lot of information on cancer and risk factors and kind of the background of it. And so I just want to give them credit for the work that they did and allowing us to reshare the information that they presented. So as Paige mentioned, one of the public health and health issues that has come to the attention of many Iowans over the last couple of years is our cancer rate. So in terms of the nation, Iowa has the second highest rate of new cancers in the United States. And another thing that is concerning and being watched pretty closely is that other states around the country have improving cancer rates, and Iowa's rate is actually rising. And in Iowa, over half of the counties in Iowa have a higher incidence rate than compared to the rest of the United States. Black Hawk County is one of those counties with a rate that's higher than the national average. We are one of 56 other counties with rates over that national average. No counties in Iowa are below the national average. So we're either sitting right at or above our national average compared to the rest of the states across the country. I do want to just kind of point out a few terms that are going to be used when talking about cancer data, and Aaron will use these terms when he's talking. Incidence is defined by a number of new cases of disease occurring during a specified time period, and mortality is defined as the number of deaths from a disease that occur during a specified time period in a population. We're going to use both of these terms when talking about cancer in Black Hawk County. And with that, I'm going to turn it over to Aaron, who is going to go through some of the specific data related to Black Hawk County.
Yeah, so every year there are about 812 new cancer diagnoses in Black Hawk County. And then when we're looking at our age-adjusted incident rates for all cancers combined, we can see that we're higher than the US average. And when I say age-adjusted, what I mean is like we're standardizing the age distribution. So then our county, who might have a couple of younger population because of our state school, we can compare that over to maybe another county that has like an older population, and it'll be a little bit more of a fair comparison. And by doing that, we can actually rank our counties. And when we look at all 99 counties for just overall cancer incidence, Black Hawk County ranks 20th of the 99 counties. And then when we look at metro counties, actually, we see that there's 21 counties that are considered metro counties, and we're ranked number 4 for overall cancer incidence. And again, what Kaylin was kind of saying earlier too, is when we look at nationally, Iowa ranks second highest in the US. So then on the right here, we can see there's a graph that looks at cancer incidence and then it breaks it down by sex. And we can see that there is a higher rate for males than females for overall cancer incidence. And then you'll see these black lines, because we're going to be looking at a lot of graphs. What those black lines are signifying is just the US average. So if it's higher than that line, then we're higher than the US average. And if it's below that line, then we're lower. And when I was kind of looking at the data, I was wondering if kind of seeing that males' rates were higher than females, is this kind of similar than kind of what other states or nationally what we're seeing? And it is similar to national trends. So males tend to have a higher rates. And what the data was kind of saying was it might be due to a couple different factors, either like lifestyle differences, occupational exposures, or biological factors is what I was finding in the data. Next slide, please. And then we're actually able to break it down. So incidence rates for overall cancer by race. And when we see that we're breaking it down by race, there are some pretty clear disparities. So non-Hispanic Black residents have the highest incident rate, and this is above that black line. So we see that's higher than the US average. And then when we look at non-Hispanic white residents, that's right around where that black line is. So kind of hovering around the US average, a little higher. But then Asian Pacific Islander, non-Hispanic, and then Hispanic rates are lower than that black line, so lower than the national average. And when we're looking at this data, we can kind of see like either this graph or any other graph. It helps us kind of determine potentially where we could direct some of these resources to target the most affected populations. Next slide, please. Perfect. So then this one is looking at kind of like a combo of the last two graphs that we're looking at. So we're looking at not only race, but also sex breakdown. And on both sides of the graph, we can see that males have higher cancer incidence than females. But then when we look on the left side of the graph, we can see non-Hispanic Black males in our county represent the highest incidence subgroup. And I was looking in the data and I was seeing is that kind of typical across national studies. And what I found was that Black males tend to have a higher rate for prostate, lung, and colorectal cancers. But as you can see, that black bar is the US average. So we can see that non-Hispanic Black population is higher than that national average, whereas non-Hispanic white population in our county is a little bit closer to that national average. Next slide, please. So now looking at cancer deaths. So this is instead of incidence, now it's mortality. And each year we're kind of seeing an average of 250 cancer deaths in our county per year. So pretty close to the national average. But earlier I said for incidents, there's like we were ranked 20 out of 99 counties for incidents. We're seeing that where our rank is a lot lower, so 54th among 99 counties, with high incidence and low mortality. That could suggest potentially we have maybe better access to treatment or our local healthcare infrastructure or just earlier stage detection. But it is good to see that we have a lower rank for our mortality than incidence. And then when we look to the right side, we can see that broken down by sex, and we can see very close to the US average, but then when we see males versus females, males are just a little bit higher than the US average and higher than female rate. Next slide, please. And then deaths by race as well as sex. So we can see on the left side, non-Hispanic Black, and then broken down by sex, and then on the right, non-Hispanic White, broken down by sex. And we can see that non-Hispanic Black males have the highest cancer death rates. And when we look at kind of non-Hispanic white rates, male and female, they're very close to that US average. But then when we look to the left side of the graph, we can see that each of these bars are higher than that black line that signifies the US average. Just kind of showing kind of while we're looking at incidence and mortality, that Black residents face higher risk with like incidents coming in, but also worse outcomes. Next slide, please. Now, this is looking at all the top cancers, so incidents in Blackhawk County. So the new cancers coming in, what are the top 5? And the rank number 1 is prostate cancer, then female breast cancer number 2, lung cancer, then colorectal cancer, and then melanoma. And when we're looking at prostate cancer and lung cancer, we can see they're almost in the top 10% of kind of incidents where we're seeing a lot of cases comparative to other counties. But one thing that I wanted to kind of point out is if we look at number 4, so our number 4 of incidents, but then when we look at the rank of counties on the right, it's ranked number 72. And that's really low actually for what I would expect. And there's probably a lot of different reasons, but some of the things that I was kind of seeing when I was looking at national studies of what potentially that could be is it could be either local screening efforts aren't really good, or on the other side of the spectrum, it could just be underdiagnosis. So that's something that we might want to look at in the future, is just looking at kind of what are the underlying causes of this and see if this is something that we're seeing in our county, or if our screening efforts are the reason why we're seeing a lower rank compared to other counties. Next slide, please. Perfect. So this is the same graph, so the top 5 cancers, but then looking at it by race. So on the left, non-Hispanic Black, and then on the right side of the graph is non-Hispanic White. And as we're looking at the right, we can see that black bar is really close to the race that we're seeing for kind of the cancer incidence for non-Hispanic white, but then we look on the left side, especially for prostate cancer, non-Hispanic Black is a lot higher rate here locally than we would expect for the national average. And I was wondering, again, kind of looking at national data and studies to see, is this something that we're just seeing here locally, or is this something nationally that we're seeing? And I found a study that kind of looked at this, and it's found that Black men have about 70 to 110% higher incidence and mortality from prostate cancer than white men. And that study kind of went on to see maybe why. And there wasn't just like one finger to point at the reason why, but what they were saying was it could be contributed to kind of a multiple of factors like genetics, hormones, potentially just catching the cancer a little bit later in its development, and then barriers to treatment. Next slide, please. Perfect. So then this is the last data slide that I'll cover, but this is mortality of the top cancers in our county. And you'll notice right away the top 5 are a little bit rearranged. They contain the same cancers, but lung, prostate, and female breast cancer kind of switched around. And again, when we're looking at this, we can see that non-Hispanic Black residents have a higher rate compared to non-Hispanic white residents. And then specifically, we can see kind of lung and prostate cancers a lot higher rate than the national average. Because when we look at non-Hispanic white rate, we can see it's almost aligned with the national average. But then when we're looking on the left side of the graph, we can see that especially lung and prostate is a lot higher. And again, I was kind of looking to see if there's something that this is like we're seeing locally or if it's national. And I found kind of a study that was also looking at this and found that there's evidence out there when they're looking at like kind of different studies that there is increased fatality for non-Hispanic Black population, even when they were looking at different staging. So when they're looking at stage 1, 2, and 3, like, and kind of making sure that it is like comparing across that, non-Hispanic Black population was having a higher mortality. So this is something that is a highlight and an opportunity essentially for us to target interventions and screening, education, and care deliveries, something that we can look at locally. And again, we have all this data, and it's like we can see the problem. I mean, we're seeing this in even the last 8 slides that I was showing, but then it's like, what do we do about it? And I'm gonna pass it over to Caitlin, who's gonna talk a little bit more about what we can do as individuals, but also kind of what we're doing as a community.
Thank you, Erin. I think people fall into 2 groups of people. You either love looking at charts and graphs, or you just want the charts and graphs to be over with. So hopefully this presentation gets to both groups of people. One thing that was part of the 99 counties presentation back in May was really kind of a reminder that cancer is really complicated. There's no one cause of cancer. It's this combination of different risk factors, genetics, lifestyle, environment, exposures, kind of other factors. So it's pretty complicated to address it from a prevention, treatment, recovery perspective, just because of how complex it is. But we do have some information about things that can be done to reduce risk factors. And so I wanted to touch on a couple of those. Erin talked about the top 5 cancer incidence and mortality in Black Hawk County. And so, part of the public health is prevention. And so included on the slide here, some prevention tips around each of those 5 cancers. So with prostate cancer, limiting alcohol, limiting smoking, limiting chemical exposures as kind of reducing and then increasing of healthy eating behaviors. For breast cancer, you'll see trends across some of these. So for breast cancer, again, limiting alcohol, hormone replacement might be helpful, eating healthy and maintaining weight for kind of protective factors. With lung cancer, limiting smoking, I think that's fairly well known across the population, even though it's difficult to do. And then testing your home for radon as a as an action item for limiting exposure and limiting risk for lung cancer. For colorectal cancer, limiting alcohol, smoking, maintaining a healthy weight, and eating healthy. And then for melanoma, avoiding sun during those peak hours of 10 a.m. to 2 p.m., not using tanning beds, and for protective factors, using sunscreen that's at least 30 SPF, wearing long sleeves and hats outdoors, and using shade, when you're outside to reduce that sun exposure. Another important thing for cancer, not only prevention, but early detection, is screening. And so on this slide, I have listed some of the things that individuals can do to screen for cancer. So have the recommendations here. Most of them are from the U.S. Preventive Services Task Force. There are differing prevention recommendations from like the American Cancer Society, but the ones listed here are from the Preventive Services Task Force. So for prostate cancer, discussing with your doctor about that PSA test if you're between 55 and 69 and you have a prostate. Breast cancer, if you have breasts and you're between the ages of 40 and 74, the recommendation is to screen with a mammogram every 2 years. And then additionally, talking with your doctor if there's a history of a family history of breast cancer. Lung cancer screening is actually something I don't think a lot of people know about, but there is a way to screen for lung cancer. It's through a low-dose CT scan. We have some experts in our community that are very well versed on lung cancer screening, and the recommendation is that if you smoked in the last 15 years and you're between the ages of 15 and 80, that you talk to your doctor about being screened for lung cancer. Colorectal cancer screening is recommended for individuals 45 to 75, and that's either with a at-home stool-based test or a colonoscopy. Again, all of these recommendations are to consult with your doctor on kind of what individual thing is right for you based on your own individual health. And then lastly, for melanoma screening or skin cancer screening, self-examinations are really important to look for new spots or changes. And if there is something that's concerning or looks different or is changing, to talk to your doctor or a dermatologist. So Aaron mentioned in his presentation about different rates of cancer in different populations, and touched a little bit on what might be contributing to those. And so we know that there are a variety of factors that play into individual health outcomes. As a collective, we kind of call those social determinants of health. They're all of the underlying things that contribute to your health as you age. So the formal definition for social determinants of health, or social drivers of health, or another term that's being used more often. Essentially, they're the conditions in the environment where people are born, live, work, play, worship, and age. And they affect a wide range of health, functioning, and quality of life outcomes and risks. And so because their social determinants or social drivers are so important and have an impact on health outcomes, we wanted to be able to talk about those a little bit in this presentation as we talk about cancer rates and risk factors and things for cancers, because it all plays into kind of the same conversation. Social determinants of health also can contribute to kind of disparities among populations and inequities among populations. And so it's something we just kind of wanted to be able to acknowledge as a part of the conversation. And also, as acknowledging it as part of the conversation, to be able to share a little bit about what we're doing and what we know about social drivers and social determinants of health as risk factors for cancer. So one of the things that we're working on right now, along with many of our community partners, is putting together a plan for our community improvement or community health improvement. And based on feedback from the community, one of the top issues for our community right now is economic stability. And as a kind of upstream factor or thing that we can do ahead of time that impacts things that happen later in life. That's kind of how we identify upstream. So we are putting together a plan with many of our health partners on things that we can do to address underlying contributors such as those social determinants of health and the important aspect that they can have on reducing the cancer burden in our community. So I'm sharing here on the screen the goal that we have around economic stability, and specifically one of the objectives that's part of that goal is early detection and screening with the acknowledgement of the cancer burden on our community. Another thing I will just share in terms of what we at Black Hawk County Public Health have made in terms of a commitment to addressing cancer in our community, it is that we'll continue to promote programs that reduce cancer risk or burden within our community, including maintaining visibility with our outreach and education. We are continuing to partner with our health sector partners to communicate openly about cancer causes, screening, and treatment facts, what we're doing today. We're committed to advocating for sustained and expanded prevention and early detection programs, to advocate for policies which make reducing risk factors for cancer easier for all people, and continue to work across the public health system to identify barriers and solutions to enable individuals to access prevention and early detection services. And then one of the final things I would like to share is a resource page that we have that has quite a few resources on it, to be completely honest. One of the very first things, if you use the QR code or if you use the link that's provided, is the Cancer in Iowa 99 Counties presentation for Black Hawk County. That is a slide deck, and in that slide deck is a very long list of community resources that I really encourage everyone to take a look at. It does have a little bit of a repeat with the data slides, but at the end of that slide deck is a very comprehensive list of resources. So I encourage everyone to take a look at that. It also includes links to some cancer prevention programming that we have at Black Hawk County Public Health, including our Care for Yourself program, which is for breast and cervical cancer, our Iowa Gets Screened program, which is for colorectal cancer screening. And I also wanted to highlight that we do have radon kits available for low cost purchase for that lung cancer screening component.
Great. Thank you both so much for all of that information. I know I have a couple of follow-up questions. I invite anyone else that does too to put those into the chat. But before we address questions with Caitlin and Aaron, I want to pass things over to Diane Anderson. She started the Accessing Cancer Treatment Fund here at the Waterloo Community Foundation. And Diane, I would love for you to just talk a little bit about your story and the needs that you saw and the work that you're doing through the ACT Fund, we call it the ACT Fund, to reduce some of these barriers to care that we've been talking about today. If you're muted here, I'm going to ask you to unmute. There we go.
Okay.
There, I hear you.
Got it. Okay. Well, I'm Diane Anderson. I'm from Black Hawk County. In late 2020, I was diagnosed with triple negative metaplastic breast cancer, which is a really rare one with that metaplastic added on there. It's about less than 1% of breast cancers are metaplastic. I received all of my treatment, all of my care, and now my post care in Black Hawk County. And every time I get a chance, I kudos to them. We have great medical professionals in Black Hawk County, and they saved my life. I was very fortunate in that I was able to afford all of my my care and now my post care with the help of my insurance, of course, and then supplement, and then my contribution to it. But I know that just talking with many people in the treatment center, there are a lot of people, and you kind of touched on that, that are facing financial barriers. Whether it's to get a screening, if they have a suspicion that they maybe have some type of cancer, or their doctors referred them, they can't afford to get that screening. Or also, if they have been diagnosed, they can't sometimes continue to get their treatment because of financial barriers. And then post-care also. So with the help of, first of all, Mayor Hart, and then Paige and Aaron Tink at the Waterloo Community Foundation, they helped me establish a fund called the ACT Fund, and it stands for Accessing Cancer Treatment. And it's for people who are facing challenges in those things that I mentioned with cancer, who just can't quite get there. This is a fund that we grant money for those purposes. And it's for a lot of different things. So far, since I established this fund with Waterloo Community Foundation, the grants have gone to the Waterloo Cancer Center. That's where I did get my treatment, but it's not limited to that. It does need to stay in Blackhawk County, but it provides such as gas cards for transportation. Sometimes people can't even get to their appointment, or they're maybe referred to Iowa City or Mayo Clinic and they can't afford that transportation. So that's one thing that it covers. It also covers food cards, over-the-counter medications that sometimes we cancer patients need extra. And then any other costs for a patient to continue treatment or to then get that post-care. So it's really not limited. Let's see, I'm trying to think of how much funding has gone out, quite a bit, but I just keep pushing forward and trying to get those donations. And there are so many generous people in our community that I have no contact with that have donated to the ACT Fund, and warms my heart. And, we need, obviously, from hearing the presentation this morning, we need to get a hold of this. And what is sad is that some people just don't have the means to do that. So that's what this fund is about. If you're able to donate, you just go right to the Waterloo Community Foundation website, and you click, they'll show all the funds that there are, and click on the ACT Fund and just hit that donate button. You can also donate by sending in a check to the Waterloo Community Foundation right at their address. And Paige, I don't have your address right offhand, but it's there on their website.
Yes, absolutely. And we will, we'll send a link in our follow-up email as well. Maybe Erin, you could put it in the chat here too, while we're still on the presentation as well, to learn more about the ACT Fund and support that if you're interested. Yeah, Diane's been doing some really great work to spread the word, and yeah, she's raising the money and giving it right back out. Like, it's a very active, things are moving. And I know that the Cancer Center has been really appreciative of the attention that she's bringing to those issues as well. So Diane, thank you so much for sharing about your story, and the needs that you saw and what you're doing to help others in our community. I think it's incredible. It's very inspiring to see.
Thank you.
On the back end of hearing some of the sobering information and stories, about what's happening here locally. It's great to hear some good work that's being done in this area. So kudos to you. Good job. And thank you for sharing
Thank
about
you.
it today too.
Thank you.
You bet. We've had a couple of questions come in here. The first one here is kind of a clarification for, I don't know, Caitlin or Erin, whoever this makes most sense for, but a clarification if new incidents includes people who have had cancer before and then are diagnosed again.
I'm actually not sure of the answer to that question. I don't know, Erin, if you know the answer.
I don't know either. I think I'm wondering if they have it in the presentation with the methods that, because this is a lot of SEER stat data, like Caitlin was saying, like there's like a surveillance system for cancer, and I know when they're putting out this information, they have a pretty good understanding of like the methods piece as well, and I'm wondering if that's in that presentation too. But I don't know offhand. That is a good question.
Yeah. It's something that probably in the meantime, if we have contact information, Amy, we could, ask the cancer team and get a response back, but I just don't know the answer right now.
Yeah, it's interesting. Thank you. Yep, we can follow up on that. Another question was that for those who haven't smoked, what is the recommendation for screening for lung cancer? Like if they have environmental exposure, secondhand smoke, that type of thing.
So the only formal recommendation from the U.S. Preventive Services Task Force is for former smokers. I think that, if there's another situation of, you had a lot of exposure to secondhand smoke or something like that, that would be something that I would encourage you to talk to your doctor about to see if it's, something that they could walk through with you. I know that, something I always think about in terms of things that are outside of recommendations is if you're insured, what the insurance coverage would be. And that was something that I think that your provider could help you with. So, but yeah, it's not part of the formal recommendations from the Preventive Services Task Force.
Yeah, that was my question. This is Beth Anderson. I'm with Mercy One, and I handle the cancer and imaging marketing for Mercy One. And so that's always been kind of a big issue is that, how do you, even you have to smoke a certain amount in order to be able to qualify, but could somebody still get the low dose CT scan even if they don't qualify based off of those specific parameters?
Yeah. Beth, when I mentioned there were experts in the community, Mercy One was one of the ones I was thinking of. So maybe we could work together offline to try and figure that out.
Yep, that'd be great. Thank you.
Thank you. I think there were a few things throughout the data portion of your presentation here that were especially striking, but I'm curious for Caitlin and Erin as people that study these things and look at them all the time. Were there any particular pieces of the data or the trends or anything like that that was surprising or stuck out the most to you as you have interacted with this information?
I would say for me, when I was looking through it, was just kind of seeing like that black bar kind of shows the US average and just seeing, like, especially for prostate cancer, and that disparity between non-Hispanic Black and non-Hispanic White, not just for incidence, but mortality as well. So I think if you're looking through all the 99 county data slides, there's so many slides, but in one of them, it actually shows like specifically for prostate cancer, like the early stage versus late stage. And like 26% of the prostate cancer is diagnosed at a late stage. So a lot fewer than kind of what we would expect. And like when we have early stage, it's easier to treat and higher survival rates. So that's just one of those things where I feel like with so many early stage diagnoses, like you would expect it to be having like a lower mortality rate, but it's just still kind of stuck out as something that I would immediately, like a little light bulb was flashing in my head.
I think for me, it's one of the first slides we talked about with the our rate is rising while others are declining. For me, that's really perplexing, right? And because it seems to be that there's something different that is going on in Iowa that is not going on in other parts of the nation. And so there are a lot of people that are trying to figure out what that is and haven't been able to quite work it out yet. So, I know that there are additional resources being allocated to research, that came through the legislature this year. And so for me, that's one of the most interesting, I think, statistics is, what's different and what can we do about it to reverse that trend and get it going down instead of up.
Excuse me. Could I ask a question?
Absolutely. Go for it, Lawrence. Thank you.
Okay, this is Pastor Larry Stummy. I've been working for the past 5 years or something on this issue of the Chamberlain manufacturing on the west side, on the north side. In 2005, the city of Waterloo took ownership of that because it had closed in the 1900s. And the EPA had found that there was some dangerous chemicals, especially coming into the groundwater. And they had ordered, in fact, Chamberlain to do some mitigation, especially on the houses that were adjacent, because there was PCE and TCE, which are highly cancerous, cancer causing. In fact, they say don't let children play around it. That was getting in the groundwater, and that groundwater, I'm talking to engineers, had escaped as far as Logan Avenue, some of that groundwater, and Chamberlain initially back in probably before around the turn of the century, around 2000, had in several houses had installed a mitigation system, much like the radon system, and nothing that I've attended meetings as recently as 22 with this EPA, and nothing has been done to follow up on that to see whether there's and I think the cancer rate in that community, just talking to the people, is high. I don't have any proof for that. There's never been any survey, but I've seen 5 or 6 death certificates of people who lived in that area that died of cancer. And I was just wondering if anything has been done to test the soil and to test what's happening. I think EPA has called for it. I think they had an order of back in 20 to investigate homes near the site for potential problems. And just wonder if that's ever been followed, if there's ever been a survey of that area of cancer causing, because just talking to people, it seems like it's higher than it should be. Okay, that's.
Lawrence, thank you for the question. I will say that environmental concerns is probably the most common question that comes up in conversations around cancer, especially recently. And whether it's, I think, is Chamberlain a brownfield site? I feel like it is. I would have to double check my facts on that, but especially, brownfield sites in other areas that are known to be contaminated, but also, water quality. That's another hot topic in terms of the cancer conversation in Iowa. I do not know the answer to your question because we're a little bit removed, but there might be someone on this call that does know the answer to your question, or again, kind of with Beth and Amy's questions, I'm happy to help track down the answer to it after this session.
Paige, can you hear me?
Yeah.
There's one thing that I would suggest, and I'm not sure that that's been done in the Chamberlain area, but I have initiated 2 different cancer cluster investigations. They were both done in Hudson. One was done at the school that I taught at for 34 years, and 12 of us teachers within 10 years were diagnosed with breast cancer. So the Iowa Cancer Registry at the University of Iowa will conduct a cancer cluster investigation on situations like that was just being described. And then I had another one done in a neighborhood, a small neighborhood in Hudson, where there was kind of some spill off from the junior high where I taught, from that parking lot into that neighborhood. Dr. Michelle West and Dr. Mary Charlton spoke at the 99 counties presentation in Blackhawk County. I believe that was in May. They are just fantastic people to work with. They're very knowledgeable. They get right back to you. They're great communicators. But I think this is something, and I had talked with Dr. Mickey Johnson about this, about the Chamberlain area. And we were going to try to do something possibly too. I'm not in Iowa right now, but when I get back, we were going to try to work on some things. But when I first started the cancer cluster investigation or wanted to do something, I first contacted Blackhawk County Health, and they were so helpful and listened to the whole thing, referred me to the Iowa Health Department in Des Moines, and then that department put me in touch with the Iowa Cancer Registry, who then began that. Well, they collected data first, and then they started the investigation. So I think it's really needed in that Chamberlain area because I've heard the same thing from people I've met that live in that area or around that area, that an investigation really needs to be done.
Yeah, I think that's a great solution to bring to the table, Diane. Thanks for telling us more about what that process can look like. When we don't quite have the answers here. Yeah. Oh.
Yeah.
Oh, go ahead.
Can I speak?
You may.
Okay. Hi, this is Robert Tyson, and I'm a member of Jubilee United Methodist Church. And we've been investigating the Chamberlain's area for several months now. And we're kind of concerned about what's going on. And I know that there's a listening session next Wednesday, I believe, which is really important. And we've been trying to encourage residents in the area to attend that. But our church has taken that on, and we've made a couple of phone calls down to Kansas City just to check into what's been happening with the Chamberlain's area. And we still have concerns about what is going on because there's just not enough information out there about Chamberlain's yet that people have concerns about. And so that is kind of a focus of our church, and we're going to continue that. And again, we just want to encourage anybody that has questions or stories that they want to share next Wednesday at the public library at 12 noon to come on down and share that information. But just wanted to say that, and thank you very much. And thank you, Dr. Stummy.
Yeah, Robert, I appreciate you bringing up that opportunity. That was on my list as well. And that was another thing I was going to include in our follow-up email too, is about the listening session that Robert is referring to. So that's being held at the library next week. The Iowa Environmental Council, Harkin Institute, and Iowa Farmers Union, they are hosting these listening sessions throughout Iowa this summer to explore potential causes and risk factors for these our state's high cancer rates that we've been hearing about today. And so that is open to the public. It's a free session to attend. And so we'll send out some information about that and getting registered for it if it's something that you're interested in participating in. And it sounds like for this specific concern here in Waterloo, it'd be a great place to talk about that, since it's a concern and something that it sounds like a lot of people are digging into, which is great. Awesome. Let me Let's see here. What other questions did I write down while you guys were talking? We talked a bit about some of the like interventions, different things that people can be doing. Are there any like local programs or partnerships or screening events or things like that, Caitlin, that are promising, things that are hopeful when it comes to improving some of these outcomes? What types of partnerships are you excited about?
Yeah, that's one I definitely can answer. So
Finally, something you know the answer to.
Tough questions are good because it means that, we're thinking critically about, how to improve our community. And I love that. It, and so I don't mind the tough questions either. But in terms of local resources, I mentioned that we have a Linktree site, which will take you to the resources that have been compiled. I will say, Diane, we don't have that ACT fund on there yet, but I made a note to add it. So
Perfect.
we'll add that one soon. Other programs that are listed on there include programs that we have at Blackhawk County Public Health. I briefly mentioned the Care for Yourself program, which is a federally funded program. We just got our funding resumed, which is fabulous news for our community. That covers breast and cervical cancer screening for individuals with with financial barriers. We also have the Iowa Get Screened program, which is a similar program for colorectal cancer. There's either a FIT test or a colonoscopy option. Those are kind of the early detection programs that we have. And then in terms of prevention, I mentioned the radon kits that are pretty low cost, compared to like a retail store where you might buy one. We have those available for radon screening. Radon is the second leading cause of lung cancer after cigarette smoking. So, we definitely encourage everyone to have their home tested for radon on a regular basis. And so we have those available. We also have a new program that is called Vaccines for Adults. And a program that's been in place for a very long time called Vaccines for Children. And those programs help with cancer prevention from a vaccination standpoint. So HPV vaccine can cause a variety of different cancers, and we are able to offer individuals that need help with access to immunizations, access to that immunization through our Vaccines for Children and Vaccines for Adult programs. And then there's a lots of different other resources listed there from community partners, anywhere from other kind of support programs like Splash of Color or Beyond Pink, other things kind of for support programs, all the way to, Pathways has, access for cigarette smoking and tobacco cessation programs. So a big variety of resources that are linked to, how individuals can access prevention and early detection tools.
That's great. Thank you for walking through a few of those. I know even just personally that I know a couple of people who have, participated in some of the free screening or, some of those different programs or events, and it's been very important that they did. And so yeah, I appreciate you walking through some of those. And
yeah, typically in October is when we have our free screening nights for breast cancer screening. We partner with a variety of healthcare partners and support program partners on those free screening nights. And so we usually will get the information out for those in, I think, September or October is when that information comes out. But that we plan to do that again this year.
That's great. Thank you. Thank you. I know we talked a bit today about, some of the different barriers that can prevent someone from getting some of those early interventions for detection or prevention, some of those types of things, whether it's, the transportation to get there or the ability to do your copay or, any of those things. I mean, if you, and I extend this to you too, Diane, if you have thoughts on it, if you had kind of a magic wand to like erase one of those barriers, like what do you think would make the biggest improvement here in Black Hawk County when it comes to some of those most prevalent barriers that you see? Like what would make the biggest difference if we could fix one thing like that?
Can you hear me? Can you hear me, Paige?
Yeah.
Okay. Okay. Well, Caitlin and Aaron kind of touched on this too, but I mean, we all know early detection saves lives. It saved mine. And I think if like Caitlin said this, the breast care, is it like a mammogram truck? Or I thought it was from last year. I thought I had seen that it was like a mammogram truck. If, again, with the ACT Fund, if anyone has a problem getting to a screening, and hopefully getting early detection or finding out you don't even have a cancer diagnosis, we would be glad to help with that. And I mentioned Dr. Mickey Johnson. He and I met with Aaron Tink at Waterloo Community Foundation last month, and we had kind of talked about it'd be kind of cool to partner up. And he was thinking of some things through, I think, Mercy One and Unity Point, with a cancer screening for prostate cancer that he has experienced, and in Waterloo, and then I would maybe try to do something with the breast cancer screening. Although it's not just the ACT Fund, I also wanted to mention is not limited to breast cancer just because I had breast cancer. It's all cancers, all people. So I think that early detection is the best, but continuing treatment too. Sometimes people start their chemo treatment and it's tough. It's tough physically, emotionally, and financially. So that's what we want to help with, that financial part. So I think continuing treatment also helps eliminate those, what did Aaron say, 250 deaths yearly in Black Hawk County.
I think my answer is a little more abstract. Just from, working in public health, if I showed that wheel of the social drivers of health and how they're anywhere from education to access to care to, social connections. I mean, there's 5 of them. If I could wave a magic wand and make it so there was no longer, any determinants of health that made it so your health outcomes were going to be different when you were an adult. That would be my wish if I had 3 wishes, right? That is extremely, extremely hard to do. So if I have to pick one, I think, our community told us that economic stability and transportation and housing were top issues. And so I would probably pick economic stability. And, because the more, what Diane just said, the more financially stable that you are, the more successful you're going to be in terms of your health outcome, whether that's preventing cancer in the first place, or if you do have a diagnosis and you go through treatment, what that treatment journey is like. So, I think for me, that would be the one.
That's great. Yeah. Thank you. Thank you both. Thank you, Caitlin, Diane, Aaron, for sharing all of this information today. I really appreciate you breaking all of that down and helping us to understand the complexities of the issue and the importance of it here in our community too. And so really, really appreciate you guys joining us and sharing today. And thank you to all of those who have joined us as well. We appreciate your interactions and your stories today too. Thank you so much for for joining us. We have been recording the session. We'll email out a recording that you can watch back or share with others who are interested. We'll also link to some of the follow-ups and resources that we've talked about today too. So thank you, and keep an eye out on your inbox for that. Our next Windows on Waterloo will be on Wednesday, September 3rd at 11 o'clock again. We'll be talking about childcare and the challenges that are presented here in our community. We'll hear from some providers and some interesting models and solutions that have been implemented here locally too. And so if that's of interest to you, we hope to see you next month as we dig into that topic. So thank you all again for joining us. Wishing you a wonderful rest of your Wednesday and week. Thanks so much.